I took the step to close all our borders, and I ordered a mandatory quarantine and testing of all the 1,030 persons who arrived at the airport at the time of the announcement till the day the borders were closed. Indeed, 78 of the persons put under quarantine have since tested positive for the virus. It is these additional confirmations that have increased dramatically our total number of cases to 137. Indeed, 97% of all confirmed cases are travelers who brought the disease from outside our shores. Of the remaining 59 confirmed cases, 53 are receiving treatment and are doing well, and they will be discharged should their second test results prove negative. 4 of them are being managed at home in self-isolation. 4 persons who were tested positive for the virus but were aged and had other serious underlying medical conditions have lost their lives. May their souls rest in perfect peace. Thankfully, 2 persons have made full recoveries. Fellow Ghanaians, the oath of office I swore on 7th January 2017 demands that I dedicate myself to the service and well-being of you, the Ghanaian people. It is my job to protect you, and I'm determined to do just that. As I've said before, all the government is doing is intended to achieve 5 key objectives: limit and stop the importation of the virus, contain its spread, provide adequate care for the sick, limit the impact of the virus on social and economic life, and inspire the expansion of our domestic capability and deepen our self-reliance. Thus far, we've succeeded in halting any more importations of the virus into our country. And I thank the overwhelming majority of you for adhering to the good hygiene and social distancing protocols announced in my first broadcast to you. However, prevailing circumstances mean the stricter measures have to be put in place to contain and halt the spread of the virus within our country, especially in Accra, Tema, Kosoa, and Kumasi, which have been identified by the Ghana Health Service as the hotspots of the infections. In doing this, we cannot afford to copy blindly and do all the things some other well-developed countries are doing. There is no one-size-fits-all approach to this pandemic. We have a unique situation in our country, and we must take it into account in dealing with the disease, whilst meeting all the 6 key WHO guidelines on the most effective ways of combating the pandemic. Even though it may be said that the number of our infections is still relatively low, if we act now, purposefully, we have a chance of preventing an escalation of our numbers. So, effective 1 a.m. on Monday, 30th March, some 48 hours from now, I have imposed, pursuant to the powers granted the President of the Republic under the Imposition of Restrictions Act, 2020 Act 1012, restrictions on movement of persons in the Greater Accra Metropolitan Area, GAMA, which includes Awutu Senya East Municipality, and the Greater Kumasi Metropolitan Area and contiguous districts for a period of 2 weeks, subject to review. It'll give us the opportunity to try to halt the spread of the virus and scale up effectively contact tracing of persons who have come into contact with infected persons, test them for the virus, and if necessary, quarantine and isolate them for treatment should they prove to have the virus. In Greater Accra, the following areas will be affected: Accra Metropolis, Tema Metropolis, Tema West Municipality, Lejekuku Municipality, Krowa Municipality, Adenta Municipality, Ashiaman Municipality, La Nkwantana Medina Municipality, La Dadekotopo Municipality, Okakwe North Municipality, Ablekuma North Municipality, Ablekuma West Municipality, Ablekuma Central Municipality, Ayawasu East Municipality, Ayawasu North Municipality, Ayawasu West Municipality, Ayawasu Central Municipality, Ga West Municipality, Ga North Municipality, Ga Central Municipality, Ga South Municipality, Ga East Municipality, Kole Klote Municipality, Wejagbawe Municipality, Bon Katamanso Municipality,